Hey drivers, YouTube's DOT physical expert, Dr. Nuesse, back again with another video. And in this one, we are specifically talking about cardiovascular conditions as it relates to the DOT physical. So heart problems, heart conditions often that drivers will come in with, and can they actually pass the DOT physical and get a CDL medical card? And I'm doing this video because it was requested actually in the comment section of one of my other videos. So please, if you have any suggestions for videos on information about the DOT physical that you would like to see, please leave those in the comment section below. I do read those comments. I respond to most of them as well, and I also make videos based on suggestions. And also, please stay subscribed to this channel, because whenever the FMCSA makes any changes to the standards for the DOT physical for CDL medicals, I make update videos. I don't want drivers going in not knowing the standards and getting hit with something that maybe could delay them getting their medical card or maybe even disqualify them. So please stay subscribed and please hit that bell so you stay notified when I make new videos. All right, so in just a second, I'm actually going to show you and read to you the standards set by the FMCSA, the guidance that they give us, the doctors, to provide DOT physicals, and I'll give you my interpretation of it and how I actually evaluate somebody that comes in with a cardiovascular condition when I'm doing a DOT physical on a driver. But first, I'm going to give you two key important points. Point number one is our job, the medical examiner, is not to figure out how sick someone is when they come in to get their DOT physical done, or what medications they should be taking, or how to treat a specific disease. Our job, the point of the DOT physical, is to figure out if it's safe for you to be on the road. Is it safe for you to operate a motor vehicle? The FMCSA is trying with these medicals to prevent people from being on the road if they're at risk for not operating the motor vehicle safely. If you're going to pass out or fall asleep or have a stroke while driving, causing a catastrophic situation. I mean, these are really large vehicles, very dangerous if you get into a wreck, can cost lives, can cost thousands or hundreds of thousands of dollars in damage. I'm in the Cincinnati, Northern Kentucky area a couple of years ago, and I don't think it was related to a medical issue, but a tractor trailer, a truck, turned over on one of the bridges, and it blew up the bridge basically and shut the bridge down for over a year. So, you know, they're really trying to prevent these kind of catastrophic situations from happening. So that's a very, very important point. Our job is not to figure out how sick you are, how to treat you. It's to figure out if it's safe for you to be on the road. All right, and point number two is the FMCSA is going to give us a lot of guidance and a lot of standards, but they're also going to give the doctor a lot of leeway to use his or her best clinical judgment. I mean, we're the ones in the room with the driver. We're the ones asking them questions, listening to their heart, those kind of things. So what I'm going to give you is how I evaluate the drivers that come in with cardiovascular conditions based on the guidance that I'm going to read to you. But certainly this is not going to go across the board. You may run into a doctor doing your DOT physical that may do it completely different, or maybe not completely different, but definitely have some variation from what I am going to tell you that I'm going to do. So I'm going to tell you how I interpret the guidance from the FMCSA, but there could be a little bit of variability to this when going from provider to provider. All right, so now let's actually look at the guidance from the FMCSA, and I will walk you through how I use this guidance to evaluate a driver with a cardiovascular condition. All right, and I will actually leave a link in the description box below where you can actually look at this guidance if you would like to, but this is down here at number 4. It's one sentence. The driver has to have no current clinical diagnosis of myocardial infarction, angina pectoris, coronary insufficiency, thrombosis, or any other cardiovascular disease of a variety known to be accompanied by syncope, which is passing out, dyspnea, which is shortness of breath, collapse, or congestive cardiac failure. And then we'll skip down to, and then also has no current clinical diagnosis of high blood pressure likely to interfere with his or her ability to operate a commercial motor vehicle safely. So I've done a complete video on blood pressure. I will leave a link to that video up here. Make sure that you fall into the right blood pressure standards, because the blood pressure standards are very, very specific. We're going to spend most of our time talking about number 4, all of the cardiovascular diseases. All right, so this is how I interpret and evaluate a driver based on this number 4 guidance from the FMCSA. Now, if you have had a myocardial infarction, if you've had a heart attack in the past, does that necessarily disqualify you for the rest of your life? The answer to that question is no. Now, there used to be very specific guidance, which we don't have from the FMCSA at this point, that said that you had to wait a couple months after you have a heart attack and then be cleared by a cardiologist. So again, I kind of still just go by that standard. If you've had a heart attack within the past 2 months, you will be disqualified. If you had a heart attack longer than that, like let's say you had a heart attack a year ago, I will ask for your cardiologist to clear you that you're not at risk for having another heart attack, because again, having a heart attack while driving a huge vehicle can be catastrophic for you and for everyone else around you when, if you're driving, if you have a wreck. So I will ask for cardiovascular clearance, that it's safe for you to drive, that you're not at risk, at imminent risk for having another incident. But myocardial infarction, having a heart attack in your past, is not necessarily disqualifying to me. Now again, this can vary. Another provider, another doctor could read this and go, if you've ever had a heart attack, you cannot be certified, but that's not how I do it. All right, number 2, angina pectoris. Now, if you've got a current diagnosis, if you've got incidents of angina pectoris, meaning that you get sharp pain, that you get dizzy or faint, I mean, this is a very, very serious thing. This is a disqualifying condition. So again, if you write down on your paperwork angina pectoris, I will ask you about it, and if you've got a current diagnosis of it, I will ask you to bring me from your cardiologist a letter stating that you do not have these symptoms anymore. They're either controlled by medication or they're controlled by lifestyle, but you're not at risk for having another incident, because if you have one of these incidents on the road, again, it can be catastrophic. If your cardiologist cannot provide that to me, if you're still at risk for having these events, then unfortunately that is going to be disqualifying. All right, next up is coronary insufficiency, and this is a very broad term, narrowing of the arteries. If this is a current condition that you have, again, a cardiologist could clear you saying that you're not at risk for having any of these other issues, syncope, dyspnea, collapse, and so on, but you would need that cardiovascular clearance again in my office. Thrombosis, kind of the same thing, a blood clot. Now, if you've had a blood clot in the past, many, many years ago or even months ago, and you can provide cardiovascular clearance that it's not an issue for you anymore, then obviously you won't be disqualified for the rest of your life because you had a blood clot in your past. But a current diagnosis of a blood clot is going to be disqualifying, even in my office, again, even with cardiovascular clearance. That's something that has to be dealt with first. And then we get to any other cardiovascular disease that can be accompanied by, again, all of those symptoms. So again, if we, the medical provider, feel that you've got something in your history that will cause you to be dizzy or pass out or have a stroke while on the road, we are not, unfortunately, going to be able to certify you. And then finally on that list, it very clearly states congestive cardiac failure, congestive heart failure. Again, if you're a driver, you come into my office and you have a current diagnosis of congestive heart failure, that is an automatic disqualifier. You cannot get cardiovascular clearance to pass that part. If you come in, you write congestive heart failure down, and that's a current diagnosis that you have, even if being treated, that is going to be automatically disqualifying. As well as if you have episodes of dizziness or shortness of breath or anything else that I think would make you unsafe based on a cardiovascular condition. All right, so I hope that was very, very clear and useful right from the FMCSA, their guidelines and how I interpret them. Again, I don't want drivers to be completely freaked out when they go in to get their DOT physical done just because they've had something cardiovascular in their history, in their past. They're not automatic disqualifiers across the board all the time. Your cardiologist can be very, very helpful, so just make sure you can work with them and you're in touch with them as well. But there are some things that if you go in and you currently are diagnosed with these cardiovascular issues are going to be problems when trying to get your CDL medical card. All right, drivers, until next time, everybody, stay safe.